everybody, it's Dr. Paula Kowalski with Kowalski Chiropractic. As most of you know, I am expecting myself, so I'm about 27 weeks pregnant right now, almost to my third trimester. So Dr. Tyler and I are both going to go over a few exercises that are completely safe and awesome during pregnancy, and we're going to break it into first, second, and third trimester. So I'll be going over second and third trimester, and he's going to do the first trimester. A little caveat. As with a lot of other stuff during pregnancy, make sure you're checking with your own OB or midwife, making sure these exercises are okay and tailored for your own self. There's certain conditions during pregnancy you want to avoid some of this stuff with. So just make sure you're checking with them first before you perform any of these. Otherwise, we'll go ahead and get started. All right, in the second trimester, you may notice a little bit of the separation of the abdominal wall in through the front here, completely normal during pregnancy. That's just called diastasis recti. So with a lot of these movements and with core during pregnancy, what you want to make sure, if you notice any of that coning where your abdomen starts to kind of come up a little bit, you want to be avoiding that movement. So a lot of the movements, if you're doing like sagittal crunches and stuff like that, anything in the sagittal plane, the front and back plane, you want to avoid those during pregnancy. So a lot of the stuff you want to make sure you're doing is breathing in through your abdomen and making sure you're expanding really well through that core there anytime you inhale. And then when you exhale, you just want to come to a relaxation. So when you're doing a lot of these movements, making sure you're kind of doing abdominal bracing, but still doing your proper belly breathing as well. So just avoid any of the movements if you start kind of seeing your abdomen kind of cone a little bit. That's not great during pregnancy. You want to try to modify and find some other good core exercises to do instead. So we'll start with that. What we're going to do first is just a little bit of a split squat. So you can use a little TheraBand if you have here. And you can start first just by kind of bringing it closer to your chest here, kind of doing that abdominal brace. Just do some simple little belly breaths right here. You can kind of move that TheraBand outward. This will just kind of help challenge those core muscles just a little bit more. Good. And then with the outside leg forward, you can even go down into a squat a little bit while you're doing those movements. Just like that, okay? And then the next one, we're gonna do the same thing, and we're just gonna do a regular squat. So we're gonna add a little bit of that resistance to the core. If you can't go down quite as well, definitely just modify. You don't need to be going down. If you start noticing any lower back pain, any abdominal discomfort, anything like that, definitely just modify and don't go down quite as well. You'd rather have proper form and do it correctly than push it and start injuring yourself. There we go. And those are your two squats. All right, the next exercise is going to be a wall squat. So get down low if you can. Knees should be about a 90-degree angle with your hips. Next thing you can do is actually add in a little bit of like a wall slide. So a little bit of working on thoracic extension, mobilization, kind of activating all those muscles in through the back here. Okay, and then the next other thing you can also do is just sit here, hold that wall squat while you're practicing on the belly breathing. All right, this next exercise is called the slow roller. It's really great for all trimesters. One thing to kind of keep in mind with this one, make sure you're doing your belly breathing and really working on the breathing while you're going through these movements. The other thing is go nice and slow and controlled. You don't want to be going through the movements really quickly. It's better to just take your time, making sure you're getting proper activation through the core. So what you're going to do is you're going to start on your back, just like this. And it kind of starts out in the position of the dead bug. So you're going to get up into this position. So while you're going through those movements, you want to go nice and slow. You want to make sure you're not using your head. Everything should stay kind of exactly how it was in the position of the dead bug. So this goes into a progression where you are on your side, kind of like a side plank. Elbow should be underneath the shoulder here. Knees should be about a 90-degree angle. You want to come up and bring the arm and leg forward like you're kicking a hacky sack. and back down. And then you can even do a few reps of those if you'd like. Same thing, working on that nice, good belly breathing. And then you can do the same thing and going back down in reverse.